Welcome to another edition of Lone Star Family Health Center's The Checkup. Today our topic is understanding Medicaid versus Medicare. As you may not know, Lone Star Family Health Center has patients with both types of insurance. But it can be very confusing, not only to them, but the public on what each one is and how it can benefit you. So I want to start off with introducing our guests today. We have Natalie Castro. She is our EHR Project and Training Manager. And then we have Laura Roses. She's our Medical Billing Manager. And then lastly, Cindy Martinez, who is our Payer Contract Specialist. And I know they have plenty of knowledge on the subject and more. So let's get with it. Okay. So we're going to start off with understanding what is Medicaid. So Natalie, can you tell us just in a simple answer what Medicaid is?
So Medicaid is a health government program available to patients that's primarily based off of income.
Simple enough, right? And then who is eligible for Medicaid?
So those who qualify, it's usually children, pregnant women, seniors, and patients with disabilities.
Okay, perfect. So recently, and a lot last year, Medicaid had been in the news with changes from the federal government. We see a lot of myths in our industry about this program. For example, one of them is, that if you're on Medicaid, that does not mean you get care at your doctor's office, a health center, or hospital is subpar. I think people feel like, if you're on Medicaid and you're not going to get great quality care. But as we know, we have great quality care here at Lone Star Family Health Center. So, Cindy, can you talk a little bit about that, about, Medicaid patients and not, the stigma of maybe not getting the care that they need?
Yes, no, that's a complete myth. We here at Lone Star, we always strive to give every patient the same high quality care, regardless of what kind of insurance they have. Right.
Yeah, we're here for all. I think that's a big thing that we're always trying to promote is we care for all, regardless of whether you can pay for your visit, if you're on Medicaid, if you have private insurance. We just want to make sure that everybody gets quality care.
Correct.
So another question about Medicaid is Medicaid only for, more like family medicine? Does it cover dental or vision care?
So usually for children under 21, there are dental services available and coverage available. And then for adults like seniors, depends on the plan. Some plans do have some limited dental benefits available.
Well, that's good because I know we see a lot of patients, especially with having a dental service here, that a lot of times that care goes untreated because I just went to the dentist the other day to get my teeth cleaned, but it's not a priority as maybe, getting your child vaccinated or, you have a broken, hand or you have a cold or something. But I think a lot of things that we learned from too, and what I've learned from being in the healthcare industry is dental and vision are just as important as your body as well too.
Correct.
So, yeah.
Definitely.
Yeah. So how do you apply for Medicaid? Even if you're a Lone Star patient or not, how does one do that? Do you have to go online? Do you have to, go to an office or, is it simple? Can they come here?
Yeah. Sure. So there are many options, which is amazing. So everyone can have a way to apply. You can apply online. It's called yourtexasbenefits.com. But we do have staff here available at Lone Star Family Health Center that can help you apply. There are financial assistance counselors that can assist you with Medicaid, but also with our sliding fee discount program that we have available to patients who can qualify based on income and household size.
Yeah, that's right. I'm glad you brought up the sliding fee discount program because that's one of the things that make us a federally qualified health centers. We have to offer that, and we have great staff that'll help you do that. And you may see some upcoming changes for our sliding fee application on our website, so stay tuned to that. It may be in the works, and but easily adaptable and easy for patients to get on and apply for that sliding fee. So stay tuned for that. Okay, so one of the myths or misunderstandings I think that is out there is that Medicaid is the same as Medicare. Similar names, but they're different. We know it's not the same thing. So what is Medicare?
So Medicare is a federally coverage for patients that are 65 and plus, or also for patients that have disability. They will also qualify for Medicare services.
Okay. So there's different parts to Medicare, and I know this because of my parents, and I know I get confused, so I can only imagine how the public feels and maybe even our patients out there. So what are the different parts of Medicare?
Medicare. Yes, so there's 4 parts. There's Medicare Part A that covers the hospitals visits. Medicare Part B will cover the physician visits. Medicare Part C, it's a replacement to the Medicare traditional. It covers both A and B parts.
Okay.
Medicare Part D is prescription coverage.
Okay, simple enough. You just need to know where the letters apply to what the coverage is. Yes.
And then for Medicare Part C, when they enroll in Medicare Advantage plans, some Medicare Advantage plans will offer added benefits to the patient, like the vision or the dental, or even dietitian and healthcare, things like that, that traditional Medicare doesn't give.
Yeah, I think that's kind of where I get confused about is Medicare Advantage private insurance? Is it still Medicare? I think my parents have that part of it, but even working in healthcare, even though I'm in the marketing world, that still confuses me. Yeah.
So the Medicare Advantage or Part C is they are supposed to cover the basis of what traditional Medicare covers, your Part A and Part B.
Yeah.
But that the Part C just gives additional coverage and benefits for patients other than just traditional service.
Okay. And do you again, when you reach that great age of 65, do you have a choice where you could take one over the other? That kind of stuff. Is there more cost?
Yes, so Medicare Part C, like Laura was saying, it's through a commercial insurance plan. So
like Humana or Aetna or something like that, Blue Cross Blue Shield.
Yes.
Okay.
So that they're just it's a different line of business per se on the insurance side versus traditional Medicare. That's like the government coverage.
Gotcha.
But it covers the Part A and Part B of what traditional covers. And like Laura was saying, it has some additional benefits that if the patient wants to add those, dental, vision.
Right.
And usually enrollment is at the end of the year.
Okay, that's a great thing to point out.
During December, they have open enrollment where a patient can change their plan, so they can go from traditional Medicare to a Medicare Advantage plan of their choosing every year.
Great. I'm glad y'all pointed that out, because I know there's open enrollment with the marketplace insurance, but there's open enrollment with Medicare, so that can also be another thing that's confusing to people as well too. So, so a question that I had that I personally wanted to ask as well too was, is everybody required to take Medicare? And what I mean by that is when you turn 65, are you automatically enrolled in it? I know, we, pay for that through our checks and, so we're paying into that program, the federal government program. But like when you turn 65, are you automatically enrolled in it?
So they are enrolled into Medicare Part A, which is the hospital coverage.
Yep.
But if the patient wishes to get into Medicare Part B, they would have to pay a certain amount to enroll in that part.
Okay. I think that's a good point to make, that you turn that age, you get enrolled in that, and then you have to take the other steps to apply or get enrolled to Part B, and then the whole thing with Part C and all of that stuff that you have found out the answers before all of this. Okay, one of our other kind of myths or misunderstandings is that Medicare covers all healthcare costs. This may kind of apply to the different parts of it as well too. So this may be kind of the same answer to that question previously.
Yeah, so Medicare will cover, your medical services, again, depending on the part of the alphabet that the patient has.
Yes. Yeah.
But, Part A, if they only have Part A coverage, it will only cover the facility of the hospital services. So Part B is important to have because that gives them more coverage of the medical services and prescription with Part D. Yeah. And then also it covers nursing home care. Okay. So long-term care as well. The one thing it doesn't cover is like dental services. So that's where sometimes Part C or the Medicare Advantage comes in place if the patient wants to have those additional coverage service.
Right, and I think we all agree here it's better to have coverage than to not have coverage. So I know from personal experience, something that I thought when my parents got a certain age is that Medicare covers long-term care. And what I mean about long-term care is home health care. For years. So if you need somebody to come in and, bathe you and clothe you, but for years, not just for a short-term care. So does Medicare cover that?
So it's actually a common misconception. It does not cover that. It only covers like short-term care, such as like rehab or things like that, but not long-term care. No.
And from what I understand, you have to have what they call long-term care insurance. So again, a myth that I think that people think, oh, well, I have Medicare, it'll pay for my home health care person to come in for 5 or 10 years. So, okay. Good to know. Well, that's the end of our video for the checkup. I want to thank Natalie and Laura and Cindy. I know this has helped me with some of the questions that I had, and I'm sure some of our followers will now be able to understand the differences. Thank y'all so much. Y'all are one of the best parts of Lone Star Family Healthcare. Y'all have a vast knowledge. That's why I asked them to come on the checkup. They're actually our official second guest. So they did a wonderful job. So thank y'all so much. And we hope y'all learned something.
Thank you. Thank you.
Bye.
If you're a patient of Lone Star Family Health Center, we hope to see you soon. If you're not and would like to become a patient or learn more about us, you can visit us at lonestarfamily.org or give us a call at 936-539-4004. Subscribe and stay tuned to our next edition of The Checkup.